The projected 2027 Medicare Part B premium is about $209.50 a month. It's a projection, not a decision. The official number comes this fall. Today's standard premium is $202.90 a month. That is the starting point. The projected increase is about $6.60 a month. Last January, that same premium jumped about $17.90. Raise announced, premium deducted. January pays the difference. Projected smaller this time. Last January, the premium increase ate roughly a third of the raise. Under the 2027 projection, it would take closer to an eighth. Same machine, different year, a very different feeling in the deposit line. If Social Security pays you, that premium never reaches your bank account. You do not write a check. You do not get a bill. Social Security takes it out first. You only see what's left. Two federal agencies set these numbers, two announcements, two different calendars. Neither one mentions the other. Nobody publishes the difference between them. The raise measures a national basket of prices, not your household bills. The Social Security increase is announced in October after September's inflation reading. The Medicare Part B premium is confirmed in the fall, usually November. Both changes take effect together in the payment that arrives in January. January is the first month you can see the real answer. As of today, the 2027 raise does not exist as a number. Only one of its three measuring months has been published so far. Any 2027 figure circulating now rests on one-third of the data. The projected premium isn't final either. Medicare sets it this fall. Nothing you do changes either number, but you can understand both. Medicare Part B is the doctor side of Medicare. Part B coverage pays for office visits, outpatient care, lab work, preventive care, walkers, oxygen. Part A covers hospital stays. Part B carries a monthly premium almost everyone pays, a yearly deductible, then 20% of most charges, with no cap. The standard premium covers about a quarter of what Part B costs. Tax money covers the rest, so spending drives the premium. If you receive Social Security, your Medicare Part B premium comes out before the money is deposited. No bill. It never reaches your account. The raise has a formal name, the Cost of Living Adjustment, or COLA. Nobody votes on it each year. It is a formula written into law. The formula uses CPIW, the Consumer Price Index for urban wage earners and clerical workers, a measure of what everyday goods and services cost. Social Security averages that index for July, August, and September against the same 3 months last year. That change is the raise. The cost of living adjustment for 2027 has not been announced. It comes in October. Anything circulating now is an estimate built on partial data. Picture someone building a 2027 household budget this September who has already seen 4 different percentages on 4 different websites. Not one is official. That projected Medicare Part B premium of $209.50 comes from the Medicare Trustees Report published in June. Medicare sets the real figure in the fall. For 2026, the premium rose from $185 to $202.90. That is $17.90 more a month, close to 10% in a single year. So the shape is simple. A raise is announced. A premium is deducted. January pays the difference. This time, the projected subtraction is smaller. An illustration, a check of $2,000 a month before anything comes out. A round number chosen to keep the arithmetic easy. Not anyone's real check. Today, $2,000 minus the 2026 premium of $202.90 leaves $1,197.10 deposited. A widow on a survivor benefit watches that deposit line, not the percentage. Run last year the same way. 2.8% added $56 a month. Subtract $17.90. What landed was $38.10, about a third of the raise, gone. At 2%, the check rises $40 before deductions. Subtract the projected $660. What lands is $30 more a month, $400, $80 for the year. At 2.5%, the check rises $50. Subtract the projected $660. What lands is $43.40 more. and $1,797 becomes $1,450. At 3%, the check rises $60. Subtract the projected $660. What lands is $53.40 more, closer to an eighth of the raise, not a third. There is a protection in the law, usually called hold-harmless. In most cases, if your Part B premium comes out of your Social Security check, the dollar increase in that premium cannot be larger than the dollar amount of your raise. It keeps the deposit from going backward. Under the scenarios we just walked through, it never comes into play because a raise of $40 or more is bigger than the projected $660. Not everyone sits inside that protection. Someone who enrolled in Medicare at 65 but has not claimed Social Security yet has no quiet subtraction. A quarterly bill arrives on the kitchen counter instead. They are generally not held harmless. Neither is anyone starting Part B for the first time that year, including someone turning 65 in early 2027. And SSI, Supplemental Security Income, gets the same percentage, paid at the end of December. Two more that catch people. Someone comparing plans this fall may believe that a Medicare Advantage plan with a $0 monthly premium makes the Part B premium disappear. It does not. You still pay it every month. Anyone who signed up for Part B late can owe a permanent penalty on top. And people whose premium is paid by a state Medicare savings program feel no increase. Their raise arrives whole. There is also IRMAA, the Income-Related Monthly Adjustment Amount. It is an extra charge on top of the standard Part B premium for higher incomes. Same coverage, higher price. It works in steps, and it looks back 2 years, so 2027 uses the 2025 tax return. Picture a couple who did one Roth conversion in 2025, now waiting to see whether an ordinary year gets charged. There's a separate video on IRMAA alone. FERS is the Federal Employees Retirement System. A FERS retiree gets a smaller raise than the headline when the increase is large. At 2% or less, it comes in full. Between 2 and 3, it is capped at 2. At 3 or more, it is the measured increase minus 1 point, while paying exactly the same Part B premium as everyone else. CSRS, the older Civil Service Retirement System, gets the full amount. The premium is not the only thing that leaves before the deposit. Voluntary tax withholding comes out. A drug plan premium comes out, if you chose that. And the income lines that decide how much of a benefit is taxable have never been adjusted for inflation, so a raise can pull more of it across them. A January raise is also catching up to last year's prices. It is not a gain. Here is what is actually known today. The raise for 2027 arrives in October, once September's inflation reading is published. The premium is confirmed later, usually November, by the Centers for Medicare and Medicaid Services, the agency that runs Medicare. Until both of those land, every 2027 figure in this video is an estimate, and a mild projection for 2027 promises nothing about 2028. This premium is reset every single year. One more thing, plainly, this is general information, not advice about your situation, and every 2027 number here is an estimate until the official ones arrive. So, one line, a raise is announced, a Medicare Part B premium is deducted, and January pays the difference. For 2027, that subtraction is projected smaller than last year's. Not a bigger raise. A smaller subtraction. That is the number to look for in January.